Hi viewers, today we are going to see one of the commonest procedure done in our cosmetic surgery center, that is rhinoplasty, nose correction. Today I am going to explain how I am going to analyze a client and how we are going to plan the procedure, what we are going to do the client, and what are the pros and cons of each procedure, and what are the common side effects we come across. This is one of the complete video for the rhinoplasty, that is nose correction. So if you analyze our client, if you see here, we analyze face as a whole first. We analyze how is the projection of the chin and how is projection of the nose and what are the problems we commonly see in the nose. Some people, they have a hump here. There is a small hump here which always gives them a worry. They come for the hump reduction. Few people, if you see this nasal bone, this width of the nasal bone is very wide. They want to narrow it to give a aesthetically pleasing nose. So most of the clients, they themselves say what they want and what is bothering them. So next common problem, if you see, is the for him the nose height is very good. Few people, it will be so depressed. The nasal height, this bridge is so depressed. So they want to increase the height. So that's also one of the common problem why they come for. Other common problem, if you see a lot of people, the nasal tip is so bulbous. For him also it's a bulbous. So they want to narrow the they want the sharper nose. So they come for that. Few people, if you see this base, the nasal base will be so wide. They want to narrow the nasal base. Okay. These are all the common problem one patient comes to us. Another common problem is the deviated nose. This whole thing will be deviated like that because of the septum. Inside there is a septum which divides the right and left nose. So that one deviated, so the whole nose looks deviated. So these are all the common things for which the patient come across. So though we give few options to correct the problem non-surgically, but all the non-surgical options, say example, if the nose is depressed like that, we can put the filler or some fat to increase the height. Okay, and these few things can be done by without doing any surgeries. But those are all the temporary options, some are permanent options. But whatever we do non-surgically, producing a aesthetically little bit pleasing result. We can't achieve the results what we will get it through surgery. Okay. See how we do perform the surgery. So there are two approaches. One, we don't make any external cut. We go and make the cuts inside the nose and we finish the whole surgery using that nose. What is the advantage? Most of the time the problem of the nose surgery is the persistent swelling. Probably sometimes the swelling will be there for 3 to 6 months. The patient has to wait at least 6 months to know what exactly happened, what is the surgical result. So the waiting period is so long if you make the cut here, which is open rhinoplasty. So the closed rhinoplasty, the advantage is swelling will be less and there is no visible scar externally. What is open rhinoplasty? Open rhinoplasty, if you see, we make a small cut, we make a small cut here. Through the cut, along with the inside cut, we make a small cut here. So the swelling will be more. The tip swelling is one of the swelling which goes last. So the swelling will be more in the open rhinoplasty. So, but that as a surgeon and if you want to do a lot of work together, obviously open rhinoplasty is the best. And very minimal work, only we want to introduce an implant, the closed rhinoplasty is best. So what we normally do is we go with open rhinoplasty for a major work, and for minimal works we do only closed rhinoplasty. So each problems how we address. Say example, if there is a broad nasal bone, we need to break the nasal bone and we have to push it to the center to reduce the width of the nasal bone. Most of the clients are afraid how doctor you're breaking the facial bone, what is going to happen. But all the facial bones have a wonderful capacity, wonderful property of healing fast. So wherever we keep the facial bone, it heals in the particular position and gives a very good result. So that's the principle what we are using here. We break the facial bones in both the sides and the nose tip, the nose root, and we just push the nasal bone to the center, give a aesthetically pleasing look. And other problem is the hump. The hump, even he has a small hump here that has to be reduced by rasping the hump, and sometimes we need to remove the cartilage in the hump in the front. And other common problem what I discussed earlier is the broad nasal tip. We have a cartilage called medial crura which comes all the way down here. You see a bulge here and here. Both the bulges are because of the excess medial crura. So we have to remove this excess medial crura, and same time most of the Indian clients, they need lot of defattening. Lot of fat will be there in this tip, so we have to defatten that. And if you do both the things together, the bulge in the side will go down. Same time, most of the time they will have a drooping tip. So for that we need to give support to little bit elevate the tip. For giving the support, sometimes we use the septum, the septum which divides the right and left nose. So that septum can be used to elevate the tip. Sometimes if the septum is not adequate, sometimes second time, third time coming to the rhinoplasty, we use the ear cartilage. We take a ear cartilage from the ear and we used to give support to the tip. And finally, as I said, to reduce the base of the width of the base, and for that we need to make a small, we remove a small bit of tissue both the sides and we stitch it. The scar what we are going to give here goes in the groove of the nasal area, so obviously the scar won't be visible. So these are all the common things we do using by rhinoplasty. And what is the common problem they normally come across? See, rhinoplasty is a lot of biomechanics involved. So sometimes we can't predict exactly how it goes. So sometimes they need to come for the secondary touch-up procedures if they feel this part is not a good doctor. I am happy about all of the part. The mild difference in the right and left side, mild small correction need to be done. Yeah, obviously secondary correction can be done after 4-5 months later. And other common problem is that, as I said earlier, the swelling. You have to wait till the swelling subsides before attempting for the secondary corrections. And what else you have? Sometimes we fix the cartilage in the front. Sometimes the cartilage may slip, and those kind of things can be addressed in a small local procedures. So if you assess the patient properly, and if you address the problems and discuss the problems with the clients properly before the surgery, and end results will be definitely good. Most of the time the problem comes if you don't discuss with the patient and don't tell what you can achieve. Don't over-promise the patient. Always you tell what you can achieve out of your surgery. If you over-promise the patient, that only provides a lot of problems. So they have like lot of expectations. So obviously end results though good, it may not be they may not be happy. So always you have to explain to the clients what you can achieve by surgeries. And the after surgery casts for each procedures are different. If you break the bone, it is different. If you only address the teeth, that is different. If you use the implants, aftercare plans are different. So each after surgery plans will be individualized, should be individualized. I think I gave a brief idea about what is rhinoplasty and how we perform the surgeries. Thank you very much.